Good morning. We are so honored today to be here with Dr. Stephanie Patterson. She is a critical care pediatrician from right here in Nashville, Tennessee, at Monroe Carroll Jr.'s Children's Hospital at Vanderbilt. Good morning.
Good morning. Thanks for having me.
Thank you so much for sharing your genius, your mind, your research with us, and for breaking it down for people like me who, before our life in the ICU, had never heard of what a microbiome was.
Well, I'm happy to be here.
Awesome. Well, first we'll start out. What made you want to get into pediatrics?
So I chose a career in pediatrics because I think children are our future, and helping them live healthy lives actually helps us have healthy communities and healthy adult societies too. So I just chose it because I think it improves our lives and our entire world, honestly.
Awesome. Well, we are so honored to support your current research project, which is investigating the intestinal microbiomes for children with CHD in the critical care setting. Can you explain to those like me who had never before this heard of what a microbiome was? What exactly is a microbiome?
So, a microbiome is a collection of actually bacteria or organisms that live on our skin, in our airway, and most importantly, in our gut. And they collaborate with our cells to actually keep us healthy. You can't see them, but there's millions and millions of them. And they're actually very important for the health of our bodies.
Awesome. So, how is that important when it comes to your ability to fight infection, your ability to feed or absorb your nutrition properly?
So our gut has thousands and thousands of bacteria that help us actually digest and metabolize all of the nutrients and food that we put into our bodies. There's enzymes and different chemicals that these bacteria secrete so that we can actually absorb our food. And in combination, they actually impact our immune system, and our immune system will collaborate with the bacteria, and the bacteria actually add and trigger our immune system to help fight infection as long as it's healthy. If it becomes unhealthy, those bacteria can actually invade our bodies and cause infection.
Interesting. So, can you explain to our listeners or our followers why is this particularly important for children who have congenital heart disease or who are in the ICU recovering from open heart surgery or from a procedure?
So it's most important for our kids with congenital heart disease, or honestly, any kid with any
Yeah.
critical illness, because oftentimes we're not able to feed them, or they're not able to eat like they normally would. Maybe they have a tube that's helping them breathe, or maybe they've had surgery on their abdomen, or just had heart surgery, and they're not able to eat like they normally would. So trying to keep that microbiome healthy when you're not normally getting the nutrients that actually help those bacteria stay healthy can have big impacts to their health and actually set them up for infection later. And so it's really important for us to find ways that we can keep the microbiome as healthy as possible, and also allow them to absorb the nutrients that we do give them, and keep them from getting infections that may actually be caused just because we've altered their microbiome from their illness.
Gotcha. So, what is the goal of your research?
So the goal of my research particularly is to study this microbiome in critical care patients. Right now is the congenital heart population, and there's very few studies of what happens to your gut microbiome when you're really sick. We know what it looks like for a healthy person. We know what it looks like for adults who have um, different intestinal illnesses and things, but we don't know a lot about what a healthy microbiome looks like in children. And we definitely don't know what it looks like in patients with critical illness. So my study would both identify what happens and what changes happen to the microbiome, and then study ways for us to improve it and help keep it healthy so that they're not at risk for those infections, and so that they're still getting good nutrition and they're able to heal well and grow well, even in the midst of their illness.
Awesome. So all of the research projects that we have funded are so personal, but this one in particular to me. So for those who don't know our story, I know I've filled you in um, about our journey with Brett, but we had her first open heart surgery when she was 4 months old, and then we spent the next 100 days in the hospital. So there were so many avenues of places for her to acquire an infection. She was on the vent. Of course, she had her scar. She had a PICC line, a central line. Um, she was on continual dialysis those last 2 weeks or 10 days or so. And so also all the while, she was unable many, many, many days to have any nutrition more than TPN and lipids. And we had several scares of a blood infection, and then we had several scares of neck. We had um, times that we had to be on antibiotics that at the time you have to throw the antibiotics that you can because you don't have time to wait to see what bug it actually is. And so ultimately she became resistant to so many antibiotics because she had been on so many over that course of her treatment. And so this is so personal to me because I feel like this could have made such a big difference in the trajectory of her treatment and her options. Because ultimately, what happened was she was doing really well, and 2 days before we lost her, her blood pressure bottomed out, and we knew this time the blood infection was real. And so, but at that point, she was resistant to every treatment that we had for that blood infection. So what are your goals? How do you feel like this could have changed what the information that we hope to acquire from this could have changed her path? And of course, for those that come ahead of her, as far as being able to properly treat the right bug or blood infection.
So some of our preliminary data shows that oftentimes the organisms that we get in our bloodstream or other infections is present in our microbiome prior to actually having that infection. And so if we could use this as a means of like identifying and tailoring our antibiotic therapy to patients, it would be really clinically useful and helpful to not only prevent us from using lots of really broad spectrum. And when I say broad spectrum antibiotics, I mean antibiotics that basically kill all bacteria, even the good bacteria that we want. We would be able to tailor antibiotics to specific organisms, as well as hopefully more quickly change those antibiotics to the specific organisms and prevent some of that resistance, like you were talking about, that often so many of our kids end up getting. And then we don't have antibiotics that we can offer them when they do have a bloodstream infection that needs to be treated.
So awesome. And then I know several times we were on antibiotics that were really hard on her kidneys, and then it turned out to not be the one. There was no other way to know other than to try it. And so hopefully it can be avoided, those that are so hard on the
And
immune system too.
and yeah, and also hopefully if we can find a way to keep the microbiome really healthy, maybe the amount of infections will decrease altogether. So we're not dealing with as many infections. We're not having to treat as many infections in that population because their nutrition will be better, and also we'll have just overall better health while they're still very sick.
Well, that is so, so encouraging. And we just appreciate you so much and all that you have offered our community and these kids with CHD. There's so much hope that we have felt this week. And thank you so much for dedicating your life to it. We just are honored to support your work.
Well, we really appreciate all your help and all you do to raise money and to help kids with congenital heart disease and kids that are critically ill. It's so important.
Well, thank you so much again. We're honored to help, but we'll finish with one question. what is something that you wish the average person knew about what life is like in the critical care setting in the ICU for patients and families?
So life in the ICU is sometimes full of pain and struggle, honestly, but also there's a lot of joy and triumph. And it's a team of doctors, surgeons, nurses, respiratory therapists, pharmacists, nutritionists, and most importantly, parents and their children who are fighting every day to improve their health and survive. And it's so important for people. The money and everything that's donated to help these children really helps us get those triumphs and those joys, and helps these kids to survive and live healthy lives.
That's definitely something that kept Bo and I going when we were inpatient was you can feel that at Vanderbilt. We felt the love poured in, and we could tell that when their shift was over, which always ran over 12 hours. I mean, let's just be real. But we could tell when they went home, when they got back, they racked their brain of how else can we help this kid? And it was evident, it was felt. And so I know that not only do we appreciate it, the parents that are currently fighting appreciate it, but I know all of the team there and across the world that this, hopefully this research changes, appreciate your efforts so much. So thank you again.
Thank you for having me. And we love what we do, and we love helping children and their families, and that's why we're here.